Hi, I'm Dr. Adrienne Sprouse here for your Environmental Minute. Today we're shooting on location for the American Academy of Environmental Medicine Conference in Phoenix, Arizona. We have the world's breadth of experts in environmental medicine, and today we're interviewing Dr. Richard Horowitz, who's a specialist in Lyme evaluation and treatment. Hi, Dr. Horowitz. Thank you so much for being our guest today.
Thank you, Adrienne. Pleasure to be here.
You call Lyme the great imitator. What does that mean?
Lyme disease is the great imitator, meaning that it mimics all of these diseases that people will come into a doctor's office with. For example, they'll come in saying, "Doc, I've been diagnosed with chronic fatigue syndrome," or "I've been diagnosed with fibromyalgia," or "I have depression or anxiety," or "I've been diagnosed with multiple sclerosis," or an autoimmune disorder like rheumatoid arthritis or lupus. Lyme disease, like syphilis, is a great imitator. It will mimic every disease that we know of at this point in the medical literature. So the problem is, without reliable tests, you need to use a way to screen people to find out what is the likelihood that they may have Lyme. And in my book, I have a questionnaire, and this questionnaire has 38 questions. And people will answer it, they can score it, it's in the book. And if they have a score of 46 or higher, based on my own patient population, there's a very high likelihood they have Lyme disease.
What are some of the symptoms that your patients come in with?
Patients were coming to me from all over the United States complaining of fatigue, joint pain, muscle pain, tingling, numbness, burning, memory problems. And I started looking at the causes of why these people were sick. Now, I was living in one of the most Lyme endemic areas in New York State, and I learned, like most doctors, that Lyme should be an easily diagnosable and treatable condition. But what I discovered, in fact, is that the blood tests are not reliable, the organisms can persist, and that these people were coming with tick bites, which they hadn't really noticed, and many organisms were getting into their body. Not just Lyme disease, but many different bacteria like Ehrlichia or Anaplasma, parasites which were malaria-like, like Babesia, Bartonella, which was cat scratch fever. So these people had gone from 10 to 20 doctors looking for a cause for their illness, and what I discovered is tick-borne diseases are actually quite common in the United States, and in fact they're spreading worldwide. Lyme is the #1 spreading worldwide epidemic, and unfortunately the blood tests are unreliable.
So at the end of the day, what you're saying is that even though it's difficult to test for Lyme and the numbers are increasing, there really are treatments that patients can undergo, and there's hope for these patients.
The hope for people out there is that if you've gone to 20 doctors and no one can tell you why you have headaches and you're tired and your memory's not working and you have aches and pains, you may have Lyme disease and associated co-infections, and the answers are in my book. And if you follow the 16-point model, meaning you treat the Lyme, you treat the co-infections, you look to see if there are environmental toxins like heavy metals and mold, you open up the detoxification pathways and get rid of some of these toxins, you balance the hormones, you get these people to sleep, you look for nutritional deficiencies like zinc, which can cause inflammation. If you balance out and look for all of the 16 nails in the foot of the patient, what you will find is people get better, and 90 to 95% of the people who come to see me do get better. So there is hope for people who have suffered for a long time, and my book outlines it in detail, so know that you don't have to live this way for the rest of your life. There is an answer, and we need to do more research, but certainly we've discovered some very important answers where people can and do feel better.
Dr. Horowitz, thanks so much for being a guest on your Environmental Minute.
Oh, it's my great pleasure. Thank you, Adrienne.
I'm Dr. Adrienne Sprouse, and this is your Environmental Minute.